Hi everyone. Tonight I want to walk you through something a little different. A short, gentle routine you can do right before bed that supports prostate and pelvic health. This isn't about jumping jacks or anything strenuous. It's about 5 quiet minutes that could make a real difference in how you sleep, how often you're getting up at night, and how your body feels day to day. Before we start, a quick note. I'm not going to promise this cures anything or replaces your doctor. What I am going to share is a set of gentle movements that many men find genuinely helpful for circulation, pelvic floor strength, and easing some of the nighttime discomfort that comes with an enlarged prostate or an overactive bladder. If you have a diagnosed prostate condition, please run this by your own physician first. Think of this as a supplement to your care, not a substitute for it. So why does this matter? As men get older, it's common for the prostate to enlarge, a condition doctors call benign prostatic hyperplasia, or BPH. It's extremely common. By the age of 60, a majority of men have some degree of it. One of the most frustrating symptoms isn't pain, Brett, it's disruption. Getting up 2, 3, 4 times a night, feeling like your bladder never fully empties, waking up groggy because your sleep keeps getting interrupted. Now here's something a lot of people don't realize. The muscles that support your bladder and prostate pays, what we call the pelvic floor, can become weak or tense with age, and that tension can actually make urinary symptoms worse. The good news is that these muscles respond really well to gentle, consistent exercise, much like any other muscle group in the body. That's what tonight's routine is built around. Let's walk through it. You can do this sitting on the edge of your bed or lying down, whatever feels comfortable. Minute 1, diaphragmatic breathing. Start by placing one hand on your chest and one on your belly. Breathe in slowly through your nose for a count of 4, letting your belly rise rather than your chest. Hold for a moment, then exhale slowly through your mouth for a count of 6. Do this for about a minute. This isn't just relaxation slow. Deep breathing helps calm the nervous system, and a calmer nervous system means less tension in the pelvic floor. Tension in that area can aggravate urinary urgency, so this simple step actually sets up. Minute 2. Gentle pelvic floor contractions, also known as Kegels. While lying down, gently tighten the muscles you'd use to stop the flow of urine. But don't actually practice this while urinating. That's just to help you identify the right muscles. Hold the contraction for about 5 seconds, then release for 5 seconds. Repeat this 10 times. Keep your breathing steady throughout, don't hold your breath. These contractions strengthen the muscles that support bladder control, and over weeks of consistent practice, many men notice fewer urgent trips to the bathroom at night. Minute 3. Knee to chest stretch. Lying on your back, bring one knee up toward your chest, holding it gently with both hands for about 20 seconds. Then switch legs. This stretch helps release tension in the lower back and hips, areas that sit close to the pelvic region and can contribute to a feeling of pressure or discomfort when they're tight. It's a small stretch, but it can make a noticeable difference in how relaxed your lower body feels heading into sleep. Minute 4. Seated pelvic tilts. Sit on the edge of the bed with your feet flat on the floor. Slowly tilt your pelvis forward, arching your lower back slightly, then tilt it backward, rounding your lower back. Move slowly and gently back and forth for about a minute. This movement encourages blood flow to the pelvic region and keeps the muscles around the prostate area from becoming stiff, which is especially helpful if you've been sitting most of the day. Minute 5. Final breathing and body scan. Lie back down, close your eyes, and take a few more slow breaths. As you exhale, mentally scan from your feet up to your head, consciously releasing tension in your legs, hips, lower back, and shoulders. This last minute is about signaling to your body that it's time to wind down, which supports better quality sleep overall. And better sleep itself helps regulate the hormones involved in bladder function. Now, A few honest expectations. This routine is not going to shrink an enlarged prostate, and it's not a treatment for prostate cancer or any other diagnosed condition. Please don't mistake it for that. What it can do, especially if you stick with it most nights over several weeks, is support pelvic floor strength, ease tension, and potentially reduce how often you're waking up to use the bathroom. Some men notice a difference within a couple of weeks. For others, it takes longer. And for some, other treatments will still be out of this. Try to limit fluids, especially caffeine and alcohol, in the 2 to 3 hours before bed. That alone can make you a bigger difference than people expect. If you notice blood in your urine, sudden severe pain, fever, or a complete inability to urinate, that's not something to manage with a nighttime routine. Please seek medical care right away. And if nighttime urination is happening more than twice a night consistently, it's worth a conversation with your doctor. Since there are effective medical treatments available, and this routine works best alongside proper medical guidance, not instead of it. I also want to mention, consistency matters more than intensity here. 5 gentle minutes every night will do far more for you than an occasional 20-minute session once a week. Your pelvic floor muscles, like any muscle, respond to regular patient practice. If you found this helpful, I'd encourage you to try it tonight and see how you feel over the next couple of weeks. And if you have questions about prostate health, bladder symptoms, or anything else you'd like me to cover, drop them in the comments and I read every one and I do my best to address the most common questions in future videos. Take care of yourselves, sleep well tonight, and I'll see you in the next video.